What is a cardiac catheterization or coronary angiogram? This is a minimally invasive procedure where we create a road map of the coronary arteries, which are the blood vessels that supply your heart muscle. Your doctor will order this test if they are worried you have hardening or blockages of your coronary arteries. In addition, this test can also show pressures in the different chambers of the heart and can be helpful if you have congestive heart failure or if you have valve issues. So prior to this procedure, we put an IV line and you generally get some anesthesia to keep you comfortable through this procedure. Looking at the coronary arteries takes normally less than 1 hour. After we give local anesthesia, we place an IV in the artery of your wrist in most cases, or sometimes in an artery that runs through your groin. Through this IV line, we pass a long straw-like tube called a catheter up into your heart. Through this catheter, we inject dye to create a road map of your arteries. While injecting the dye, we use a camera that moves around you and takes movie pictures of the arteries in different angles. This allows us to look for blockages in areas where the dye does not fill completely. Everything comes out after the procedure. If you have a normal study, you go home the same day. Here is a normal example where you see good dye distribution across normal blood vessels. However, if we find hardening or blockages, we would offer treatment with stents or surgery. Here is an example where you see the dye stops short, and that indicates there is a blockage in that area of the blood vessel. Stents are metal supports or scaffolds that can open up inside the blood vessel and allow good blood flow in the diseased artery. Here is an example. If you do get a stent, it's very important that you stay on medications that can keep the stent in good health and prevent it from blocking up. If the hardening or blockages are too extensive and in multiple blood vessels, your doctor may suggest that you see a surgeon for consideration of a coronary artery bypass graft surgery, or what is called CABG. We generally advise you to be careful with your wrist or groin, depending on where the doctor did the procedure. In general, this is a fairly safe procedure which gives us a lot of good information. However, there can be possible complications like the risk of bleeding, a small risk of infection, stroke, heart attack, and blood clots. Thank you. This is Dr. Mehta.